Yeah. And stick like a sore thumb. So as the viewers can see, we definitely got pigeon toe going on, okay? So tell me guys, fill us in, how long that's been going on?
Since we can really remember her when she started walking. It just kind of got progressively worse. Surprisingly enough, it's actually gotten a little bit better. She's had a little bit of a growth spurt. It's gotten a little bit better, but she is constantly tripping. She's kind of figured out how to run. She does some weird kind of kickback with her feet. So she doesn't trip when she runs, but on a just normal day, she trips a lot. Not to fall down, but she's constantly, with shoes. Obviously, when she's barefoot, she's fine. But with shoes, she has a hard time.
Gotcha. So we're going to take a look at their spine. And not only I saw in her gait, it was very obvious to see that pigeon toe going on with her left foot, but she was circumducting. And that tells me there's a potential sacral segment problem going on. And on top of it, I also see a little swelling at this level over here. And there's going to be, not surprised, a heat reading at that level too. And that's also what I see quickly as well, that x-ray, stick like a sore thumb. We still got to check. How's that? Was that pain or ticklish?
Wait, do it again.
What's this?
Pain.
Pain. What about here? Not bad, right?
Not bad.
What over here?
Not bad.
Not bad. Okay, we're going to see how everything moves. Okay, so the left side's a little bit stuck. Right side's fine. We check all the sacral segments. Okay, which was not fun? This one here? Yeah, number 2, that's not fun. Okay. How's this one over here? That's not fun. Number 4, fourth lumbar. Okay. Not bad here, huh? Nope, that's what I figured. We're gonna check everything else, how the swelling is. Not too bad. Not bad at all. Okay. Why don't I take a look at this x-ray over here? Okay, there are some things that should be normal. I want to see a normal curvature. Okay. Instead, what we see is more like a J shape instead of an S shape. This one over here, her spine we're supposed to be like this, a little more curvature this way, but no. Leaning forward this way. That's also causing a hyper arcing of the neck. It should go like this. Okay. So if we time frame this, like 70 years, 60, 70 years down the road, this is how you get one of those grandma and grandpa's, what we call dowager hump. Okay. So yeah, we can actually trace these things and start all straight down a long time ago down to her foundation. The foundation itself, I want this level, but instead what we see is why is the haunted pelvis tilted this way? Okay, so it's a little higher and taller on the left-hand side and lower on the right-hand side. Okay. The same thing as well, the femur head height is also tilted this direction as well. So it comes no surprise why the entire spine, everything is falling off like the Leaning Tower of Pisa, because the foundation itself is not stable. Okay. Now, also when we take a closer look at sacral segments itself also supposed to be nice and straight. But why is it starting to tilt right here in number 2? Boom, that direction and this direction. So this is the one that's in trouble here. We see this here too as well. Why is there a big posterior gap wide open over here?
That was a pain spot when you
right. So when I challenged and tested it, yeah, she was squirming. She did not like this one as well. So by addressing this, okay, and also taking a lot of the rotation out, it's going to be a 2-for-1 sale. So not only help restore the nerve function to her spine and also the foundation, it's also going to re-level the pelvis here as well, because with this one, this is what we call the anterior superior spine. That means her left hip is tilted this direction. And that's also because the sacrum itself also rotated a little bit towards this direction as well, in terms of sacral segment. So by addressing the sacrum itself, instead of being tilted over here, it's going to re-level this. It's also going to drop this height down, re-level it towards this way as well. So it's a combination move over there, and providing more support, it's going to have a much more normal S curvature in the lower spine, and the rest of this stuff is going to disappear as well. Now, that's also why we see here as well, it's starting to curve out here and start tweaking, going to the left and going to the right, because once again, the entire spine is going like that. I just tested her form on her. No, this is a compensation. But again, if we time frame it 10 years down the road, I wouldn't be surprised. This one eventually becomes like a stomach or shoulder problems, indigestion, all that stuff. Same thing with the neck as well. So all these stuff started, bam, right down to. Okay, so right foot, we got some collapsed arches. Left foot also collapsed arches as well. Talus, cuboid, all that's out. So we take a look at you. Okay, face towards this way. Okay, so what I'm already seeing is, okay, so cuboid is slightly bulging out. Okay, the lateral arch is slightly bulging out on the outside. That's from a collapsed cuboid, okay? And also, see, even the medial arches, they're not that great as well. Okay, so there's no way I could address this. I understand you guys are coming over from Orlando, Florida, but it's like there's no way I can address this in one session over here. So I do recommend continual care when you go back to Orlando. Okay, and also transverse arches, they're gone. Okay, so I do recommend. So I do recommend getting some orthotics. Okay, to help brace these up. Just like how braces for the teeth, she needs braces for the feet. Okay, so I do recommend a podiatrist back in Orlando, Florida, a pediatric one, because it's going to need fine tweaking from time to time.
Okay. That's a good case. Wow, well, we've had 2 doctors in different countries tell us that surgery was going to be needed at some point, and it's better now than later.
No, you'll see it yourself. Okay, let's rock on.
That's a good thing. That's what we want to hear.
No, chin that way. No, right there. Good. Okay, welcome out.
Sit up. Sit up.
Okay, come on. Walk out.
Oh my gosh.
Walk.
Okay, Papa, you tell me. How's her feet looking right now?
How do you feel?
It feels so good.
Come on.
See how her feet's doing?
That's a big change.
Oh my god.
That's a big change with just wow.
What's that?
No, see, that's what it's all come down to, because again, okay, so as you viewers can see, that pigeon toe is pretty much almost gone just from that one adjustment alone. Why? Because boom. If you have one heck of a traffic jam here, how do you expect the nerves from the brain go all straight down to the foot and come back into the brain? If you have a nice, from 5-lane highway, you knock it down to just 3 from here, gets into that. How do you expect the nerves get down here? Right?
Wow.
So we don't have that information. So the brain is sort of like ordering takeout. It says, "Oh, can I have my takeout food? Can you deliver to apartment D4?" Which is it, D4, or B4? Sounds similar, right? So the brain was thinking, "Oh, the left foot was actually in this direction," when it really wasn't. So now the brain was able to re-coordinate, send this because the sensors over here are now telling us that no, this is my actual coordinates,
Wow.
the actual position. Tell it back to here, the gyroscope in the brain, and the brain says, "Hey, wait a second, you're out of alignment." Reprogram the muscle. Nope, back to where it's supposed to be. That's what took a lot of it out. We're still not done yet because all that nerve dysfunction, it cut off the nerve supply to the ligaments. The ligaments are supposed to hold the bones together. Normal ligaments are supposed to hold the bones tight like this. But because we have that nerve dysfunction, that subluxation, what it does was it reduced the nerve supply. In other words, more traffic jam in there, not enough nerves going to the ligaments, slack. So all it takes for her is a walk around, jungle jam exercise, whatever it is. What happens? Boom. Bones start knocking out of alignment. Makes things even worse with that pigeon toe. Right? Now let's take a look at your feet. Go ahead. See? We still have a structural problem in there. So as you saw it, I just shaked it up, okay? Look at that. So the feet, there's still a little medial deviation, a little pronation going on over here. So now we're gonna see where the misalignments are. So that's what I also see in the x-ray, her talus is out, okay? We're gonna do the right one first. The right one's also out too. Okay, let it go. Just relax.
Relax. Oh my gosh.
Relax.
Ah. Oh.
The name. Now we're gonna do this one.
Relax.
No, do not say it. Just. Okay. All right. We're gonna set this one. Nice, easy peasy. Right here.
Ah.
Oh, a little more deeper. It's not all the way in.
Oh my gosh, I felt it.
Yep. Cuboid's out still.
Is it more?
We're gonna do more.
No.
Relax.
Okay,
Relax.
on your belly. Cuboid slightly out, just slightly out. Right there. Not bad. Oh, this one's not bad at all. This one, no, we gotta set this one. Let her go. Just relax. Let her go.
Oh my gosh.
Here it is. Slightly out. No, just relax. Just. Yeah. Let her go. Let her go. There it is. Okay, go ahead. Walk around.
Oh my gosh.
You walking normal? Just walk normal. Don't try to move your feet any different way.
Okay, guys. All right, so pull me in. How do you like them?
Huh?
How do you like your feet?
Great.
Can you feel it?
Tell me what's different about it.
Just say
¿Qué sientes? What do you feel?
I feel great. I've never been this way.
You like it?
Good.
My legs are shaking.
Okay, guys. Tell me, what do you think is different?
Well, they're straight. They're actually even, yeah, like I said, like she said, she's never been this way. We've never
I
seen
can
her.
feel it.
Yeah, her feet like that.
So, like I said, this is going to be a long-term strategy over here because, again, these arches, it's not fully restored. Okay, it's still compromised. See the transverse arch? Okay, this one got better. This transverse arch is still collapsed. Okay, the lateral arch, okay, this is starting to come back, but it's still collapsed a bit. Okay, this is getting better. Okay, so her right foot's not that bad, but her left one still needs work. Okay, and she's gonna need periodic adjustments to make sure we reduce the traffic jams and get it to fully functional. She's not there yet out of the woods. So we'll recommend you a Gonstead Chiropractor in Orlando, Florida. Okay?
Again, what I'm trying to do is avoid surgery completely.
Mhm.
I mean, if we need to come back here, I'm fine with coming back. Also, we can do that. It's not a big deal for us.
Or cracking.
More cracking.
Adjustments.
And
More
adjustments.
More adjustments. So if it depends on you, but I would feel fine coming back up here a couple more times for you to see her and make sure
Not a
that she's
problem.
good, and then we can stay down in Orlando.
Not a problem. Here's the bottom line. As you can see yourself, even the viewers can see, okay, this is not really a surgical case because we addressed the majority of that pigeon toe already right off the bat just by restoring nerve function to it. That's all she really needs because the surgery, it's not really going to do that as much, okay? So that's what the bottom line is. This is a conservative care.
With the surgery, they wanted to break her bones and readjust manually.
Wow.
So yeah, and I had 2 doctors say that.
Well, as you can see, no, don't need to do that. This is a neurological problem. So no, that's all we had to do. Just restore the nerve function, and you see the body heal. Is able to repair and heal itself. Now we just gotta make it consistent. All right. Let the body heal up, do its thing, and she's gonna be fine. I don't see this as a surgical case.
Does that mean more cracking?
It needs more adjustments.
What does that mean?
What they just did.
Yay!
It's gonna make you a happy camper.
Yay!
Okay.
Good.
All right. Well set, guys. Have a good time.
Thank you.
See you next
Thank you
time.
very much.